What you eat can have a direct effect on your everyday health, especially when it comes to inflammation. When your body activates your immune system, it sends out inflammatory cells. These cells attack bacteria or heal damaged tissue. If your body sends out inflammatory cells when you are not sick or injured, you may have chronic inflammation.
Disclaimer. Always consult with your healthcare provider before starting any new diet or exercise program or using any home remedy.
Like and subscribe to stay up to date with our content. Chronic inflammation can increase your risk of health problems like type 2 diabetes, heart disease, arthritis, or Alzheimer's disease. But research shows these supplements and a particular diet may help reduce that inflammation. Inflammation does not always require treatment. For acute inflammation, rest, ice, and good wound care often relieve the discomfort in a few days. If you have chronic inflammation, your healthcare provider may recommend supplements, non-steroidal anti-inflammatory drugs or NSAIDs, or steroid injections. Inflammation can be caused by poor diet choices and lifestyle habits, like inadequate sleep, smoking, and lack of physical activity. Doctors are learning that one of the best ways to reduce inflammation lies not in the medicine cabinet, but in the refrigerator. By following an anti-inflammatory diet, you can fight off inflammation for good. Here are 10 ways that research shows may help reduce inflammation. Number 1. Anti-inflammatory diet. Diet is so important as a means of reducing inflammation that it's even been studied as a way to manage chronic inflammatory diseases, such as rheumatoid arthritis. The best foods for reducing inflammation are whole and plant-based fare, including dark leafy greens like spinach and kale, cruciferous vegetables such as broccoli and Brussels sprouts, berries, omega-3 rich fatty fish such as salmon, olive oil, whole grains like brown rice and oatmeal, spices such as turmeric, cumin, cinnamon, basil, and parsley, ginger, dark chocolate. 2. Get at least 7 hours of sleep. Your body needs regular, restful sleep to maintain its immune system and so many other functions that support health. A lack of sleep is linked to a greater risk for inflammation, according to a 2021 study in Communications Biology. Inadequate shut-eye can stoke irritability and anger when you're awake, which may negatively affect your interactions with friends, family, and coworkers, and further increase inflammation levels. To keep inflammation at bay, aim for at least 7 hours of sleep to avoid increasing inflammation, and keep in mind that your sleep needs may be even higher. The National Sleep Foundation recommends adults get 7 to 9 hours of shut-eye each night. 3. Reduce stress. Stress is inflammatory, so managing stress is important in managing inflammation. Researchers have found that chronic psychological stress is associated with the body losing its ability to regulate the inflammatory response. The research shows that the effects of psychological stress on the body's ability to regulate inflammation can promote the development and progression of disease. A 2021 study in the journal Brain, Behavior, and Immunity found that people who have a strong emotional reaction to stressful tasks, like you bite your nails when you have to make a presentation at work, or get tense when someone presses your buttons, experience a greater increase in circulating interleukin-6, a marker of inflammation, during times of stress than those who take stressful tasks in stride. In other words, if you have chronic stress, your body runs the risk of being in a constant state of inflammation because it thinks it's in danger. 4. Grab a handful of nuts. Noshing on nuts as a snack for part of a meal can help reduce markers in the blood that signal inflammation, according to a 2023 review of the topic in Nutrients. Here are the best 5 nuts, which are known to be the best for reducing inflammation because of their anti-inflammatory biomarkers. Walnut. Out of every nut to choose from, walnuts are one of the best for reducing inflammation due to their high concentration of alpha-linoleic acid, or ALA, which is a type of omega-3 fatty acid that is known for having potent anti-inflammatory effects. Eating walnuts daily can reduce the concentration of several inflammatory biomarkers and is recommended for decreasing cardiovascular disease risk. Almonds. Almonds have a higher amount of fiber with 3 grams per ounce. Consuming enough fiber during the day not only assists with weight management and lowers cholesterol, but it can also help with reducing inflammation. Peanuts. Peanuts are high in arginine, which is a type of amino acid that assists with building muscle. According to biomedical engineers at Duke University, building muscle can assist with the damaging effects of chronic inflammation long-term. Hazelnuts. Hazelnuts are considered to be the second richest source of monounsaturated fatty acids and are known to be an excellent anti-inflammatory food. Hazelnuts are also a hypolipidemic food, meaning it's lower in saturated fat and is a good heart-healthy choice due to their ability to lower LDL cholesterol levels that are commonly linked to increased inflammation and chronic disease risk. Pistachios. Pistachios are rich in multiple antioxidants and are known for reducing oxidative stress that leads to increased LDL cholesterol, according to the Journal of Nutrition. Oxidative stress causes an imbalance of reactive oxygen species, which can lead to chronic inflammation. Diets rich in polyphenols like the kind found in pistachios is key for reducing oxidative stress and inflammatory activity. Remember to like and subscribe if you've enjoyed this information so far. 5. Enjoy a massage. Depending on the severity of the inflammation, massage therapy has been known to assist in the reduction of pain and swelling and promote recovery of injured muscles. Massage is known to improve blood flow, reduce tissue stiffness, which contributes to pain reduction. Regular massages can help with inflammation, improve fluid buildup, and circulation. Lymphatic massage and petriossage are 2 massage techniques that support chronic inflammatory conditions because they promote improved drainage of fluids from the tissues. Studies involving flow-mediated dilation, or FMD, show that massages to the lower extremities are significantly more helpful at reducing inflammation than the technique is in the upper extremities. Massage can also lower the levels of a stress hormone called cortisol, may reduce blood pressure, and can also reduce the production of inflammatory cytokines. All these contribute to lowering inflammation. Massage can also uplift your mood by increasing the level of the happy hormone called serotonin. In choosing to use massage therapy in supporting inflammation, it is recommended that you seek a physician's advice in case the procedure is contraindicated for your particular type of injury. Also, always inform your massage therapist about the level of your pain. If there is too much pain and inflammation, then it is always better to avoid any massage in such situations. 6. Get regular exercise. Excessive weight or obesity, or even just an expanding waistline, contributes to the low-grade inflammation that can be harmful to your health. But you can also have chronic inflammation from being physically inactive without excessive weight or obesity. No matter what your weight, it's possible to offset some inflammation in the body with more exercise and physical activity, including regular life activities like yard work and household chores. Even a small increase in activity helps tame the flames compared to being totally couch-bound. Besides prioritizing healthy foods, moving your body regularly is an important part of reducing inflammation. In the very short term, exercise stimulates production of some inflammatory markers. However, with regular exercise, studies show the inflammatory molecules and subsequent inflammatory pathways are reduced. 7. Drink green tea. Even if coffee is your beverage of choice, you may not want to bag tea altogether, especially the green variety. Green tea is full of potent antioxidants that can help quell inflammation. It's packed with compounds known as polyphenols that fight off free radicals. These molecules can promote inflammation in your body. You don't have to kick your coffee habit altogether. Consider swapping out 1 cup a week for the green stuff. A 2022 study published in Current Developments in Nutrition found that consuming the equivalent of 5 cups of green tea daily reduced inflammation in the gut. Green tea can inhibit oxidative stress and the potential inflammation that may result from it. 8. Stop smoking. Smoking comes with a laundry list of harmful effects. Higher levels of inflammation is one of them. Smoking alters bacterial communities in the stool, and this alteration may be associated with inflammation. Many studies have shown that the main characteristic of chronic diseases is systemic inflammation. Smoking increases inflammation in the body by causing accumulation of inflammation, promoting bacteria such as Bacteroides, Lactobacillus, Prevotella stereochorea, and Rhamnococcus in the gut. Decide to quit and pick a day to do it. You don't have to go it alone, though. Your doctor can come up with a plan so that you can kick the habit for good. Reducing inflammation in the body may require a comprehensive approach, and every person's response can vary. Some might need medications, others might have to make specific dietary changes to manage inflammation effectively. You should not make any change in your health regimen or diet before first consulting a physician and obtaining a medical exam, diagnosis, and recommendation. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. Please subscribe if you found the information helpful so you don't miss our next video.